of the movement disorders clinic here. And Apurva and I have been working over the past year or so, treating people with various kinds of dystonias, and I've given Apurva a lot of referrals for my patients because I do believe that the treatment of dystonia needs to be multidisciplinary. It just can't be a pill or Botox or just one modality. It has to be a more holistic approach, which is not unlike what we do in other diseases such as Parkinson's. Having said that, in our clinic, we of course treat and evaluate dystonia. We have the medication arm. We have the Botox Clinic every week, and then we utilize physical therapy, occupational therapy, and speech therapy for the treatment of dystonia, depending upon the kind of dystonia. And I often give referrals to Purva and my other neurorehabilitation colleagues for the treatment of dystonia. And it's a very multifaceted treatment. The treatment has to be customized to the patient and the kind of dystonia they have. And as you know, dystonia is extremely heterogeneous. I think the biggest challenge with dystonia often is the appropriate diagnosis and the time to diagnosis. It's both overdiagnosed and underdiagnosed. A lot of things are called dystonia when they're not dystonia, and then a lot of dystonia is missed by specialists. In terms of overdiagnosis, I've seen people with neck pain, shoulder pain, back pain, all kinds of pain being diagnosed as dystonia. Pain is a fairly important and prominent component of dystonia. It's a very important non-motor symptom, but the diagnosis of dystonia depends on the recognition of motor symptoms. So if I examine a patient and I don't see a lot of abnormal movement that is spontaneous, that is not driven by pain, that is not driven by a musculoskeletal issue, then I don't make the diagnosis of dystonia. One of the things, one sec, sorry. That's a clinic manager telling me that I have 5 minutes. um, I'll meet up with you guys again. So yes, one of the things that has confounded the diagnosis of dystonia is Botox. A lot of people get Botox for various reasons, for cosmetic reasons, for contractures, for bladder issues. Botox is a very good treatment for dystonia, but it is a blunt instrument because Botox also treats muscle spasms and pain. A positive response to Botox doesn't automatically mean that you have dystonia. It needs to be determined, well, what exactly improved? Did the abnormal movement improve? And this is very important. Spontaneous abnormal movements are the hallmark of dystonia. And usually the spontaneous abnormal movements are direction specific. This is also important to remember that they're not disorganized, that there is a pattern. The movements are directed in one way or another. Of course, they can be jerky, but there needs to be this underlying directionality that needs to be identified. That's what constitutes dystonia. They need to occur spontaneously. They cannot be driven by pain. They can cause pain, but they cannot be driven by pain. For instance, if I have a crick in my neck, it's really hard for me to look this way and I'm looking this way to compensate. That is not dystonia. This is very important to recognize. So I wake up with a crick in my neck and my neck is this way one day. That ain't dystonia, folks. There is a musculoskeletal radicular problem going on, which is causing that. That needs to be identified. So how it starts is very important. Usually 90% of the time, it starts gradually and progresses. You, unless there is a stroke or cancer in the brain or some catastrophic event, you don't just wake up one day with dystonia. And if you do, it usually goes away. And some people, small minority have that. I woke up one day with dystonia and it stayed with me over the years. But more often than not, that is not dystonia. So those are the clues I use for diagnosis. Once you diagnose dystonia, then you can definitely treat it very effectively. I have a feeling that people who are misdiagnosed and are being treated for dystonia, who don't have very good outcomes, likely don't have dystonia. They have something else going on as well. And then diseases come at us in twos and threes. You can actually have a neck injury, head injury, arm injury, and develop dystonia on top of that. So that is also important to recognize. Just because you've got pinched nerves or arthritis in the neck does not mean that you cannot get dystonia. In fact, there is a large school of thought that believes that some kind of injury to the musculoskeletal tissue or the nervous tissue may occur long before dystonia begins to develop. It basically resets or causes some kind of abnormality in the neurological system's firing. So that is also true. So, but it is important to recognize that the dystonia uh, exists separately from twisting and turning caused by pain. Because if you treat dystonia with Botox or these other treatments, you don't automatically treat pain caused by something else that can occur with the dystonia. So it's complex, but I really do believe that the fundamental clue is abnormal movements that have a directionality.